Graft from sister to brother is allograft. Amputated digits are preserved in plastic bag in ice. An isograft indicates transfer of tissues between monozygotic twins. Investigation of choice in the early phase of renal transplant is ultrasonogram. Hyperacute graft rejection is caused by preformed antibodies. Infection in renal transplant patient is usually caused by cytomegalovirus. Most common type of renal transplant in India is allograft. Most important HLA for organ transplantation and tissue typing is HLA-D. HLA matching is not necessary in which of the following organ transplantation? Liver. Renal transplantation is most commonly done in chronic glomerulonephritis. Steroids are used in transplantation to prevent graft rejection. Which of the following drugs is not a part of triple therapy immunosuppression for post-renal transplant patient? FK506. So which drugs are part of triple therapy? Cyclosporin, azathioprine and prednisolone. Transplantation of which one of the following organs is most often associated with hyperacute rejection? Kidney. Plastic and reconstructive surgery, skin lesion. Cox's peculiar tumor is infected sebaceous cyst. Cause of persistence of a sinus or fistula includes foreign body, non-dependent drainage, unrelieved obstruction, and presence of malignancy. Pre-malignant condition of the skin includes Bowen disease, Paget's disease of nipple, leukoplakia, and solar keratosis. Melanoma should be excised with a margin of 2 cm. Hidradenitis suppurativa is found to occur in axilla, circumannal, and groin. The best dressing is skin. The term universal tumor refers to lipoma. Hydrocele is a type of cyst exudation. Sebaceous cyst does not occur in the sole. Commonest site for rodent ulcer is inner canthus. Squamous cell carcinoma can arise from long-standing venous ulcers, chronic lupus vulgaris, and rodent ulcer. The best result in treatment of capillary nevus have been achieved by argon laser treatment. Full thickness skin graft can be taken from the following site except none. So full thickness skin graft can be taken from elbow, back to neck, supraclavicular area, and upper eyelid. Keratocanthoma is self-healing nodular lesion with central ulceration. Acanthosis nigricans is seen with colonic carcinoma and carcinoma breast. Skin flap is used in all except burn wound. So skin flap is used in bone, tendon, cartilage, not in burn wound. Free skin graft is rejected on none. So free skin graft is uh, not rejected on muscle fat, deep fascia and dermis. Kaposi sarcoma is seen in AIDS. Which of the following is a regressing tumor? Strawberry angioma. Sebaceous cyst occurs in all except palm and sole. Skin graft for facial wound is taken from post-auricular region. Spontaneous regression is seen in all except small cavernous hemangioma and port wine stain. So spontaneous regression is seen in salmon patch and strawberry angioma, not in port wine stain and cavernous hemangioma. The best skin graft for open wound is autograft. Dercum's disease is commonest in the back. Margins of squamous cell carcinoma is everted. Salmon patch usually disappears by age 1 year. Most severe form of malignant melanoma is nodular infiltrating type. Calcifying epithelioma is seen in none of these options. Best treatment of strawberry angioma is masterly inactivity. Cox's peculiar tumor is secondary to infected sebaceous cyst. Basal cell carcinoma is common in head and neck. Marjolin's ulcer is squamous cell carcinoma from scar. Boil can occur at all sites except palm. The organism causing destruction of skin graft is Streptococcus. Which of the following characterize a dermoid cyst, cheesy material and tooth? All are features of gummatous ulcer except erythematous base. So features of gummatous ulcer are punched out edges, syphilitic in nature and washed leather slough. 11th month 11-month-old child presents with erythematous lesion with central clearing which has been decreasing in size, strawberry angioma. All are true statement about malignant melanoma except that acral lentiginous have better prognosis is incorrect. What is true is Clark's classification is used for prognosis. Women have better prognosis. Limb perfusion is used for local treatment. Graft is not taken up on the following on the skull bone. Prognosis of malignant melanoma depends on depth of invasion. Man sustained an injury with the loss of skin cover exposing bone of 10 by 10 centimeters. The best treatment is pedicle graft. Skin graft survival in the first 48 hours is dependent on plasmatic imbibition. Skin grafting is not done in infection with beta hemolytic streptococci. Frostbite is treated by slow rewarming. Worst prognosis in melanoma is seen with subtype amelanotic melanoma. Lentigo maligna is most commonly seen in face. The subdermal plexus forms the vascular basis for randomized flaps. Least malignant melanoma is lentigo maligna. Regarding hemangiomas, following are true. Salmon patch disappears after the age of 1. Port wine stain present throughout the life. Salmon patch on forehead, midline and over occiput. True about Marjolin's ulcer is ulcer over scar. Commonest cancer in burn scar is squamous cell carcinoma. Prognosis of melanoma depends on stage, depth of melanoma on biopsy and site. In pigmented basal cell carcinoma, treatment of choice is excision. Diagnostic procedure for basal cell carcinoma is wedge biopsy. Split skin graft can be applied over muscle, which is not absorbable suture. Polyethylene, polyacramide and polypropylene are not absorbable suture. Vicryl and catgut are absorbable. Trophic ulcers are caused by leprosy and syringomyelia. True about Marjolin's ulcer, it develops in a long-standing scar. Squamous cell carcinoma develops and slow-growing lesion. Chronically, lymphodematous limb is Marjolin's ulcer. Treatment for pyoderma gangrenosum is surgery plus antibiotic. Which of the following materials for implants will evoke least inflammatory tissue response? Polypropylene. Malignant melanoma most often develops from junctional nevus. The best cosmetic results for large capillary port wine hemangiomas are achieved by laser ablation. Which one of the following is not included in the treatment of malignant melanoma? Radiation is not included. Surgical excision, chemotherapy and immunotherapy is given. The most common malignancy found in Marjolin's ulcer is squamous cell carcinoma. The tumor which may occur in the residual breast or overlying skin following wide local excision and radiotherapy for mammary carcinoma is angiosarcoma. Dacron vascular graft is textile synthetic. The type of tumor is Marjolin's ulcer, squamous cell carcinoma. Which one of the following statements about mesh skin graft is not correct? They contract to the same degree as a grafted sheet of skin is incorrect. They permit coverage of large areas. They allow degrees of fluid collections under the graft and they take satisfactorily on a granulating bed. In the Klatkes level of tumor invasion for malignant melanoma, level 3 refers to tumor cells at junction of papillary and reticular dermis. Mohs micrography excision for basal cell carcinoma is used for all of the following except tumor less than 2 cm in diameter. So it is used for recurrent tumor, tumor with aggressive histology and tumors with perineural invasion. Split skin graft in young children should be harvested from thigh. Chronic burrowing ulcer is caused by microaerophilic streptococci. Basal cell carcinoma is spread by direct spread. Wolfe graft is full thickness skin graft. Marjolin ulcer is a cancer in Marjolin's is squamous cell carcinoma and chronic venous insufficiency and basal cell carcinoma. The commonest clinical pattern of basal cell carcinoma is nodular. Which one of the following is not a wound closure technique? Vascular graft is not a wound closure technique. Partial thickness skin graft, composite graft, and musculocutaneous graft is a wound closure technique. Which of the following is non-absorbable suture? Polypropylene is non-absorbable. Vicryl, catgut, and polydioxazole is absorbable. Abbe-Estlander flap is used for lip. Abbe-Estlander flap is based on labial artery. Chronic burrowing ulcer is caused by microaerophilic streptococci. True about malignant melanoma. Lymphatic spread. Lymph node biopsy is done always. Block dissection to be done when sentinel node is involved. Microsatellitism. Taken of split skin graft occurs when none of these. True statement regarding hypertrophic scar, not familial and not race related. The most common malignancy found in Marjolin